My name is Charlotte Ismay. I'm a transitional nurse practitioner for drug and alcohol clinical services for the Hunter New England Local Health District. I've been working in Hunter New England for almost 10 years, but specifically for drug and alcohol clinical services for over 4 years now. My background's intensive care and paediatrics, and was looking to work as a registered nurse in the community. And in making my decision, I wanted to stay working in the public health system. Addiction and drug and alcohol was my preference for the simple reason I'm a family member of someone with a lived experience of substance use who have accessed the services here before. And they showed him such care and compassion that I felt really compelled to come into drug and alcohol. I was really lucky because I had a colleague who had come across to drug and alcohol from intensive care a few months earlier, and I was able to talk to her about her experience in the role. So had a bit of inside information as well, but the transition was really quite straightforward and amazing. What I've observed from speaking to people who might be thinking about coming into community drug and alcohol is they're afraid they might lose their clinical skills, and that is not the case at all. I find that having a background in critical care has really set me up well. You're using your clinical skills all the time on a daily basis, and a lot of people who use substances, sometimes we're the only healthcare service that they trust or feel comfortable with. So you're linking with other healthcare professionals and holistically caring for people with substance use disorders. It's very holistic, looking into, for example, diagnosing and helping treat bloodborne viruses. It's very complex and you don't lose those clinical skills. There are so many good things about working for drug and alcohol clinical services as a nurse. We have a variety of teams that you can work for. So everything from pharmacotherapy, so treating our patients with opioid dependence, to child, youth and family. So we've got youth, drug and alcohol, and our subservice substance use in pregnancy and parenting. We have peer workers that work here who are people with a lived experience who help us every day improve our services. We have a research team, which is absolutely incredible. Some of the greatest minds in drug and alcohol research, in my opinion, where you can participate and focus on clinical trials and participate and learning how to implement new cares into treatment. For me personally, as a transitional nurse practitioner, I get lots of supervision, working towards autonomous practice, and having prescribing rights in the future is something that I'm working towards. So I'm working really closely with medical supervisors and other nurse practitioners in the service to become competent in this autonomous role. So I'm seeing a lot of patients under supervision in inpatient and outpatient settings, going to places like Maitland, Muswellbrook, lots of travelling to other places throughout the Hunter New England Local Health District to help provide a service out there as well. So it's lots and lots of different clinical work out, inpatient unit at Belmont as well, getting supervised there. So they're busy days and sort of caring for people with a variety of substance use disorders, from opioid dependence to alcohol dependence and everything in between, to gain that autonomous practice. But the service is so diverse. Everyone's, for a registered nurse, depending on where you are, your day-to-day work is going to look very different, but lots of clinical face-to-face care. I have never worked in a place that offers so much continuing education and supportive, and I say that without hesitation. You're always encouraged to do postgraduate education, and there's scholarship options for that. We have an excellent clinical nurse educator who encourages upskilling for things like motivational interviewing skills and other things that are pertinent to caring for people with substance use disorders. Support to go to national conferences, to network and meet other drug and alcohol professionals from around Australia as well. There is so much support and opportunity in drug and alcohol clinical services. There's something on, honestly, every week that you can go to, and I find management really supportive to partake in these activities and to improve your skills. It's amazing. If you're thinking about making the career change into drug and alcohol, I highly encourage, as a nurse, I would highly encourage you to reach out to other nurses who work in the service. I'm happy for people to reach out to me and can tell you the ins and outs. I'm very passionate about getting nurses into the service. So I would definitely speak to someone in the service. There are some other great online resources that people could look at. Our professional or peak body is DANA, the Drug and Alcohol Nurses of Australasia. So I encourage people to check out that website as well as Your Room, which is an amazing website for health professionals to learn about harm minimisation and other principles of caring for people with substance use. So I would encourage those things as, practical resources to access, but also to have an open mind as well. This is profoundly rewarding work every single day, and have an open mind because again, some stigma associated with addiction can, in my opinion, make people think twice, and in my experience as well, but it is extremely rewarding, so keep that open mind. Another great thing working for DACS is it is highly multidisciplinary. Every team has a group of, or is made up of, registered nurses, other allied health professionals, including clinical psychologists, registered psychologists. We have midwives, we have social workers, we have a neuropsychologist, occupational therapy. It is very, very multidisciplinary, and of course a wonderful range of addiction medicine specialists who all teams work with closely, as well as nurse practitioners and transitional nurse practitioners.